When I was looking at the conference website, the thing that intrigued me was that the goal was somewhat similar to what my own website was, which was, my feeling is that people aren't talking to each other before they start going down the path and running blindly through the forest.
Yeah, no, I'm glad you bring that up. I mean, the reason why we decided to organize the conference is to really bring together in the same room all the key players, and so these are the potential customer, which could be the healthcare providers, it could be the payers, and also ask them in the first panel, well, what are your unmet needs and what's important to you, and how can your company work with you, and what does it take, to get this first beta size, which is what you need to validate your value proposition, which is really getting the company off the ground. And so that's really a panel we did last year that was extremely successful. I mean, we were blessed to have the CEOs of some leading institution like Stanford. We have some of the innovation officers at UCLA and Dignity Health, and as a result of that, these are the people telling you where the industry is going. We're no longer selling to hospitals; we're selling to healthcare delivery system, which included multiple hospital groups. We're going a little bit towards the Kaiser model, which is you have one vertical that's the hospitals, the clinics, long-term care. You have another group that's people buying physicians' practice. How do you manage that, and how do we sell to them? And the third aspect is that some of these groups, like Trinity Health, is getting so large that they want to go into the insurance business, which is a bit what Kaiser did, which is they're now big enough to create their own pool of customers in this case, and then take risk. And so there's massive change in healthcare, and really we need to understand that, because if an entrepreneur designs a product today trying to meet today's needs, he may be obsolete in 2 years the way the market is changing. So it's really critical to really ask the question to the stakeholders and see what they need. So that's the first panel. The second panel is all about the payers. We have gone from a fee-for-service system where pretty much everything was designed for the physician, and we're moving towards a whole different environment. Would you call it accountable care organization? Would you call it value-based services? At the end of the day, what we're doing is that we are going to, instead of waiting for you to be sick and coming visit the doctors and then he writes a prescription, which is the way the system is today, we are going to provide care wherever you are. It could be in your home, it could be in the mall, it could be where you're working. We're going to manage you not when you're sick, we're going to manage you all the time. And then we're trying to basically identify people at higher risk so we can be more preventive in certain type of interventions. So how is that all going to work? And it pretty much, we are doing just-in-time manufacturing in healthcare. We don't have any of the tools that we have developed in our industry. So there's massive opportunities to really develop what I call manufacturing or population management tools that don't exist today. And the question is who's going to be using it? It's nice to have a little dashboard, but if nobody acts upon it, that has no value. So really understanding all these intricacies. So healthcare is amazing right now because we have 17% of GDP that's being turned upside down. It's creating massive opportunities for new startups, but it's challenging because it's complex. There's multiple stakeholders. The rules of engagement are changing. And so the idea was to get everybody in the same room, really ask some of the big opinion leaders to say, where are things going? What are you willing to take a risk on? And then ask people, who are in startups that are having some traction there, well, what did you do to get off the ground? And how are you scaling up? And why do you see the challenges coming up? So the purpose of the conference was two things. One is to get all these people in the same room, and number two, give an opportunity for young companies to exhibit what they're doing. So we have a demo hall where people during the whole day can talk to the entrepreneurs. We'll have a venture panel with the most active investors in the space. So we're going to pick the top 5 companies. Each of them will have 5 minutes to pitch. And then they'll get feedback. And that's really important to the whole audience because they will respond to how they heard the pitch. And then they will hear how the investor respond to it. Yeah. And then we'll have 2 votes. One by the venture judges and the other one by the audience. So last year we had 2 different winners. And one was Asthmapolis that ended up doing very well. It's being funded and it's taking care of children with asthma by monitoring them. And the other one is a wellness effects, which is allowing you for very low price point, like $49 to $99, to have a battery of 30 biomarkers and the 15 minutes telehealth consult with somebody who basically tells you this is what's happening inside your body that you may not know, and so it was really great because you can see that the audience and the venture may have different views on what's interesting. Either one are both exciting companies. So we're doing the same thing again this year, where we give an opportunity for young company to raise above the noise level. We already looked at the people who have registered for the conference. Over a third of the people who are coming are investors. And we pretty much have the biggest venture names as well as the top angel groups coming. So it's an amazing opportunity for young companies to be exposed regardless if they're C Series A or Series B.
Oh, okay. So now you said that the 17% of the GDP was now flipped upside down. So what do you exactly mean by that?
Well, I think that healthcare used to be very siloed in the past, and that was a combination of the payment system, where Medicare is a very big payer, and the regulatory aspect from the FDA and other means. And so it used to be there were a lot of conflict of interest in the way that people were being rewarded for doing certain things. So, for example, if you're a payer, you're not being rewarded to do preventive care because the average time an employee will stay with you if he was part of an employer program was probably 2 to 2.5 years. So if I'm going to basically incentivize you to lose weight, I will not benefit of you not getting diabetes in 5 to 10 years. Okay, the system right now is changing, and it's really fascinating the speed at which it's changing. Where, as I said, instead of waiting for you to be sick, going to a centralized location, which would be a clinic, a hospital, an emergency room, to get taken care of, which means it's very late in the process because you're pretty acute in symptoms there. We are going to be, we're going to be looking at people basically all the time. So typically a doctor, for example, managed between 20 to 40 patients per day in the fee-for-service models. Now they're going to be managing 2,000 patients live without having to see them every day. And as a result of that, we want to use data management tools to identify patients who may be undiagnosed, or maybe have diabetic retinopathy, if they have diabetes there, and be able to intervene earlier so they don't lose their eyesight or they go to foot amputations. So this is where you have a massive change where historically the medical industry was developing product for the physicians to diagnose and do therapy. Right now, the huge opportunity is to develop products for the healthcare delivery administrators to basically identify patients, populations there that they can manage more effectively at lower cost. And they're going to be going at risk, so they're going to be highly incentivized to do that. So in the past, the payers will really try to go after the large employers and try to get 10,000 employees, and that was their business. The insurance business is being turned upside down also because now they're going to be going into trying to provide services at the individual level. So we're going to go to customized insurance program. There's around 10,000 patients converting every day right now from the baby boomers into Medicare. They will decide who is going to be provided Medicare Advantage. It's no longer the employers. So you have a massive change where finally the patient is going to be the driver in identifying the type of insurance they want, in who they're working with, and be accountable for the back behaviors. And that's something that never happened in the past. The patient was pretty passive in the way we're delivering health care. And now we're going to force the patient to be more proactive. There's going to be massive changes in how much the customers are going to have to pay. So in the past, for deductibles and our means, really most of the cost was really the burden of the employer, and that creates a lot of problems to be competitive on the global market. So there's huge pushback right now. And so right now you're going to see increase of the high deductibles. You're going to increase in the copay. You're going to get a reference-based pricing, which is basically saying if you're in the Bay Area and in a 20 miles radius you need an MRI and the cost is between $1,000 to $5,000, they're not going to pay the 80% of reasonable, which is what it used to be. They're going to say we're going to not maybe pick the lowest price, but we're going to pay only $1,500, and if you still want to go to the most expensive one, you pay the difference. At the end of the day, what's going to happen is that there's going to be a higher and higher cost that's going to be carried by the consumers, and it's going to be tied to performance. Performance will be, do you smoke, do you drink, Do you have biomarkers that shows you have certain type of condition like diabetes or cardiac problems there? And really trying to entice people for a combination of stick and carrots to change behaviors to hopefully get people healthier.
Mm-hmm.